Hi, we're going to continue on with your eval to look a little bit more specifically at your muscles in your arm. So the first thing I'm going to do is take a look at your thumb here. And what I want you to do is really lift this thumb tip up. Beautiful, okay? Now try and hold that. Hold, 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 hold. What grade is she? Now, yeah. Now we'll try it again. Go ahead and try and lift your thumb tip up as high as oh. If she didn't do anything at all, then all it is a switch of the forearm. And now let's try it here. Go ahead. Complete them all. Beautiful. Hold, 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 hold. Yeah. That eliminates gravity. So that's why I like to start on the lower ends, because you can see how quickly we can switch gravity. It's more complex when we get to the shoulder. But this will get you used to that idea of just flipping the arm and doing it a little bit different way. Now in this case, we're looking at the extensor pollicis longus. We could palpate here right on the tendon. You can see, you can actually feel and see it here, or you can palpate a little bit further down just below the wrist to get the muscle belly. So in the hand, you can palpate either, as long as you can feel tension in the tendon or tension in the muscle belly. Okay, now we're just going to move down one joint. I'm going to be looking at this one right here, and I'm going to have you relax again. Go ahead and try and bring your thumb up again. Okay, and now hold, 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 hold. So you see I move my resistance down a level here, and I'm testing the MP joint. She holds full resistance. I have a grade of. Okay. If she can't do it at all, I'm going to move her here. Okay, now try. And here's my resistance. Hold, hold, hold. Now this brings in the extensor pollicis brevis as well as the extensor pollicis longus. So again, we can look at our tendon differentiation here. Remember the anatomical snuff box? The extensor pollicis brevis is here, extensor pollicis longus here.
Can you help clarify what that rating would be? If it's anti-gravity and she can hold
Go.
moderate resistance?
She would be, okay, yeah, she'd be a 2+.
Okay.
But
usually it would break.
Right, usually it would break. So great question. Yeah, but that would have been a 2+ if she holds resistance, and I'll try and show some other grades while we're going along.
So when you do gravity, you take away gravity, it automatically goes down to like a 2, and then you just go off that.
And then if she completes that range, I can add resistance to see if she's a 2+.
Okay.
Yeah, and normally they're so weak at that point that they would break because they weren't strong enough to go against gravity. Especially in the hand, the levers are so small, right? That it, you know, they have to be pretty weak not to be able to go against gravity in the hand. It's not like you're carrying the whole arm. Okay. Now let's take a look at your ability to do something similar. What I would like you to do is try and bend your thumb tip down. Now on this one, the book is kind of, it's a little bit different position. In order to get that against gravity, you have to tweak a little bit this way, and gravity eliminated is here. So you kind of bring it so the thumb tip faces up, gravity eliminated is here. So I'm going to go ahead, and I always stabilize that joint proximal. So I'm going to stabilize you here. I want you to see if you can bend this tip down. She moves partial range. What grade is she? 3 minus, right. Because if you saw her, she kind of jiggled a little bit. She went about half range. 3 minus. Normally we'd go on. But if not, it's just a slight turn here to do gravity eliminated.
Because you don't test resistance unless she can go full range.
Right. Yeah. If she didn't go full range, I'm not going to add resistance here.
Okay.
Because she wasn't strong enough to go through full range. Perfect decision making.
Quick question about gravity eliminated. Is it like handshake then for that?
Gravity eliminated would be just, it's like this, the difference between this to get against gravity, kind of really hyper supinating, and the internally rotate, and here.
Oh, okay.
So it's kind of odd in order to get that against gravity.
So what do you do if they don't have full soup? I mean, I know most of my my patients, I wouldn't be able to get them to even do that.
Yeah. Well, you know, to tell you the truth, the hand, these gravity eliminated positions are not used all that often because most of the time you can get a partial range out of them. So even though we have them, you're going to notice the positions are kind of awkward. I'm just going here from yeah, because these are all against gravity, supinated, so the palmar surface of the thumb is facing the ceiling, and then here's your gravity eliminated at 90 degrees. It's just, yeah, if they can't do it, that's a great question. You will just note, you know, and give your approximate. So say you couldn't do that they couldn't externally rotate that far, then you just make a note of that and just use your judgment and say it's a pour or whatever you feel it is.
Could you pick up their hand or something?
Well, it still wouldn't be able to get it against gravity. So say you can't get it against gravity, you'll just make your judgment on how much resistance they could hold then in the normal position. That's going to happen here. For some muscles, we can't put them against gravity. You have to use your judgment. So just make a note, they were tested in gravity eliminated position but held full resistance. I'm giving them a 5. You know, so because sometimes that is true. You can't get them into, especially when it's that much different, right? It's just a slight tweak.
So at that point, you can really just judge based on how much resistance they have to know if they're still at full range.
Yeah. Yeah. So for that person, like in this case, when I'm going to go on and test MP flexion now, she couldn't do that. I'd have to test it from the gravity eliminated position. So I know that's difficult for you, so let's just test it here. What I want you to do is bring your thumb down like this, okay? Go ahead. And she completes full. I want you to hold fully. Even though I'm gravity eliminated here, she's holding full. I would say 5. I did it in gravity eliminated position. You know, because you just can't. And you'll see there's other places where that come into play, but that is true. Oftentimes we have to use a different position than what it is, just because maybe I can't put them on the table. You know, it's just not feasible for me to take 15 minutes of my treatment time to move them there, and I'm going to have to test them in gravity eliminated position and just use my judgment. That's fine to do. You just make a note that that's where you tested them. So, okay, so this is going to be the flexor pollicus longus and the flexor pollicus brevis. I'm going to palpate right here, right in the heart of the thenar eminence. If you notice, go ahead and pull down again, pull. You can see it contract right here. That's exactly right there. That's where my dot would go to palpate. Now, thumb abduction, if you remember, right, we have a palmar abduction and a radial abduction. The palmar abduction done by the abductor pollicus brevis and the radial abduction by the abductor pollicus longus. So we could differentiate those, but to simplify things, the book has you go mid-position when you test abduction, noting that if you find that there's weakness here, you're going to do one of the others. But what I mean by that is it's going to be up in this direction, not here or here, but kind of in between. So what I want you to do is just bring your thumb out to the side like this, okay? Mm-hmm. Go ahead and hold, hold, hold. Don't let me push you down. There you go. And here I can palpate my abductor pollicus brevis. And on this side, right here is my abductor pollicus longus tendon and muscle. Okay. Gravity eliminated is going to be, tell me, the book say pronated or supinated? I can't really remember. Here, mid-position. Here. Now come this way. There, I got it. Okay. Okay. And let's just say she doesn't complete full range. Try here. What grade would she be? 2 minus. In this case, she would not have moved at all when I had her up in this position, and I would have switched her to this gravity eliminated plane. She moves partial range. It's a 2 minus. Yeah, perfect.
I have a question for the practicum. How do you expect us to stabilize and have the other hand using resistance and then palpating at the same time? Like, do you want us to use that hand that we're,
Well, yeah. About like what I'm doing.
Okay.
Actually, normally, you don't have to palpate at the same time, you just have to show those palpation points.
Okay.
So some people state it beforehand, like I'll give an example on this one. Okay, so for the next test, I'm going to palpate your adductor pollicis here. So what I want you to do is try and bring your thumb up here. Don't do it. Okay, go ahead, try. She doesn't move. I'm gonna move her here. Okay, now try again. Come all the way in. There you go. And then I could see if she breaks or not. So if she breaks, I would give her a 2+. Yeah, I'm just teasing you now, but yeah. Because it's not the ones on the grade, but you can kind of see how you make that judgment on that scale. Okay, one more. Thumb opposition. So this one, what I want you to do is try and bring your thumb up like this to touch your little finger, okay? Go ahead. She completes the motion. I give her resistance. She holds, and then breaks. And then breaks.
3+.
Yeah, I'd give her a 3+ on that. Yeah. It's against gravity. Gravity eliminated here is almost the same as your abduction, meaning that it's coming out like this. So I want you to, if I had to gravity eliminate it here, it's going to be a neutral position kind of heading towards this. It's kind of hard to do gravity eliminated from opposition when it's crossing all planes, so they just use this mid position. Okay, go ahead and practice.